Okay, well, we're spot on 1 o'clock. So I think I might just start as well. People are being let in, welcoming you to this. I think it's the third in our series of Better Health and Care Futures webinars. So welcome to that. I'm Irene Higginson. I'm one of the directors of the Better Health and Care Hub. I'd like to just offer my thanks as well to Abby Stone from our comms team, who's helped put this series together. Really appreciate that. Thank you all then for joining us. And it's my real pleasure now to introduce Professor Jerry McGivern. He's a professor of public services management and organisation at King's Business School. And his research really pioneers how we understand how professional knowledge, practices, identities, and leadership are affected by the kind of regulation, management, and organisation in healthcare and health and care systems in the UK, but also internationally with global work underway. And he spans across kind of healthcare management, professionals, legislation, leadership, and organisation. He's got an amazing track record of publications and also a large number of grants supported by a number of different both government and charitable organisations. So, Jerry, I'm so pleased that you've joined us. He's one of our key partners in the Better Health and Care Hub. He's been advising us and informing us all the way. And Jerry, over to you.
Thank you, Irene, and great to meet everyone. I'm really pleased to be here. And as I say, I do research on basically how we organise and manage kind of healthcare systems. I've been doing that for over the last 20 years now, which is a bit terrifying. And, you know, so really pleased to come to talk to you about some research that I've been involved in. What I'm going to talk to you about today is a project which has been a really incredibly long-running project, basically looking at a collaboration that was set up to mobilise or translate, depending on your language, genetic science into practice. So a few years ago, in fact, a couple of decades ago, there was huge amounts of excitement around the potential for genetics to kind of transform healthcare. And so the government put some money into a scheme to do that, to kind of mobilise it into practice. And I was lucky enough at the time to be involved in a project where we were studying some networks, which I'll talk about a bit. And we looked at the ways in which the networks attempted to translate genetic science into practice. And one of the really interesting things came out of the research that I'm going to talk about today is the role of temporality in time. So what was really interesting is that there were problems and challenges within the network which were to do with the different timeframes and different ways in which the different collaborators drew upon time in the network, which seemed to undermine the ability of the network to actually mobilise genetic science into practice, at least initially. So I'm going to talk to you about some of those ideas today. So I'll just put up my slides and I will tell you a bit more about that study. Okay. Great. So can people see my slides? That's great. Okay.
Yeah, that's good.
So the title is, and as I say, I apologise, I often have to apologise to audiences these days of slightly over theorising things. But the title of the presentation is about temporal ambiguity in collaborations. So what I'm going to talk about is the sort of ambiguous ways in which we think about time and temporality and how that can affect collaboration. And this is a paper. This is a paper that's currently under review, which I've co-authored with colleagues Charlotte Croft at Liverpool University, Jackie Swan at Warwick Business School, and Sue Dobson at the University of Oxford in the Said Business School. So the problem really, as I said, is the idea of kind of diverse temporalities in collaborations. So I think we can all probably agree that if we're going to, well, first of all, we probably all agree that we really need to transform the health and care system. And if we're going to do that, we are going to have to develop collaborations. We're going to have to get different professionals, organisations and sectors to work together to improve the healthcare system. And so kind of in preparing for this lecture, I went on to the Department of Health and Social Care's consultation about how to build a health system fit for the future. So we can all broadly buy into the idea that we want a better health and care system that is fit for the future. But what exactly do we mean by a better healthcare system? And when we talk about it being fit for the future, when exactly in the future do we want it to be fit to achieve those purposes? And so this kind of really kind of ties into some of the issues we're going to talk around time and temporality. And one of the problems is if you're collaborating to improve health and care systems, often you have different stakeholders who have different interests, but particularly for the purpose of this presentation, they see time and temporality in different ways. And these different perspectives on time and temporality can often undermine collaborations, particularly in the longer term. So a couple of recent papers in the management journals, one looking at the literature on inter-organisational relations, talks about the assumption of universal time, that being different collaborators or different organisations who are interacting with one another, seeing time in the same way, and assuming that there's a single conceptualisation of time is a major blind spot in the research on inter-organisational relations. So this sort of problematizes this idea that we all see time and temporality in the same kind of way. And then in this sort of the higher education context, there was a recent paper by Manak and colleagues that similarly said the single most prominent barrier to university industry collaborations, and I guess this would include collaborations between universities and the government and kind of healthcare sector, result from distinct time norms. So I think it's really important that we think about this issue of time. How does the way that we think about time and temporality impact collaboration, and how can this potentially help or potentially undermine our ability to address the many challenges that are facing health care systems today? So to give you a sort of a primer, this is the sort of undergrad 101 slide on thinking about time and temporality. I'm going to talk about this notion of temporal orientation. So this is how people sort of draw upon and conceptualize time when they're making sense of the world. And as I'm going to explain, the way that we draw upon time kind of frames what we see in the world, how we understand what's going on in the world, what the problems are, what the potential solutions are, and when they might be delivered. And we can think about time and temporality in different ways. And broadly, we could think about time in relation to qualitative events or quantitative clock or calendar time. So I suppose the classic example from the picture here is, when is the train leaving? Is it at the kind of 5 to 1 as it's shown on the clock, or does it leave when the train actually leaves? When have you actually achieved a particular goal? Is it when you at the end of the kind of project Gantt chart or time plan, or is it when the actual purpose of what you're trying to achieve is achieved? And people think about these things in different kinds of ways. I suppose many of us on this call might be academics. So, when is our paper ready to be submitted for publication? Is it at the end of the summer holiday when we're just about to go into teaching? Or is it when the paper's ready, when we kind of really feel it's good enough? So this would be an example of seeing things in kind of qualitative or quantitative terms. We can also think about time in relation to past, present, and future. So when we try and make sense of what's going on now, what might go on in the future, what do we draw upon? Do we draw upon things that have historically gone on in the past? So do we try and keep things going as they've always gone? Do we think about the sort of present challenges that we're facing, the pragmatic issues that we currently are facing, and how we're going to address those? Or do we think about the future, how things might unfold and what might happen, what future challenges might arise? And if you think about these things in relation to past, present, and future, again, this can frame the current challenges we're facing in very different kind of ways. And of course, the perspective that affects how we understand the things are the timeframes that we draw upon. So if you think about things in relation to kind of the short term, often this frames them in a different way than to how we might have done so if we draw upon a longer or even an open time frame. So I suppose, again, the classic example of this might be kind of global warming. In the short term, kind of mitigating climate change and global warming is very costly. It makes our lives more difficult. So in the short term, we might think, why are we making this change? It's difficult, painful, expensive to make. We don't really know if it's going to have longer term benefits. But perhaps in the longer term, we're going to actually really regret not having taken kind of stronger action to mitigate climate change because of things that might unfold. So that would be, so as I say, there are different ways that we can think about time and temporality that lead to different understandings of what's going on in the past, present, and future. And the other point I want to make is that, there are different kinds of collaborations. So some collaborations, there might be a kind of, might be characterized what we can think of as temporal closure. So this would be an example of, for example, if we are collaborating to organize and to put on an annual conference. So in this case, the temporal closure means there's a clear goal, which is obviously to run the conference, and also a fixed deadline. There's no kind of wiggle room. It's very unlikely that we're going to be able to sort of collaborate to put on a conference and then find that we've kind of run out of time, so delay it later. So this would be an example of a collaboration that's closed. There's really no kind of wiggle room, no doubt, no ambiguity about what you're doing and when you need to do it by. But many other collaborations, and particularly in health and social care, are perhaps more open-ended and temporally ambiguous. So how, for example, might we collaborate to eradicate a particular disease? How might we sort of mitigate the effects of ill health relating to diabetes, for example? And here we might have particular kind of timeframes, time horizons in mind, but really it's kind of open-ended when we've actually achieved this aim that we're collaborating to achieve. So this would be where you might have a more qualitative event in mind in terms of what you're collaborating around. And the other point to raise here is that the sort of the goals that you aim to achieve, they kind of determine what is the appropriate kind of temporal orientation, the structures, the timelines and deadlines that you might put in place to achieve these things. But also these deadlines also influence what you're actually able to achieve. So there's a sort of chicken and egg situation, particularly in these sort of temporally ambiguous situations around what the appropriate goal and temporal structure and timeline is, and whether you're able to achieve a goal, and whether that actually has an impact on your ability to achieve the goal in mind as well. And a few years ago, I did some research which kind of really kind of got me interested in issues around sort of time and temporality in organizations. And this was a project we looked at, was a strategy consultancy project in a healthcare part of the healthcare system, where strategy consultants were brought in to help redesign a kind of local healthcare system, brought in by what was then the Strategic Health Authority. And they redesigned the project in a very short space of time, in 3 months, in fact. And for anyone working in the NHS, you can imagine how tricky that was. But what was really interesting in this project, we looked at the ways, or we described the ways in which management consultants imposed a very sort of urgent and short-term time frame on this project, which reflected their interest. So they were hired for 3 months to redesign the healthcare system. Miraculously, they managed to come up with a plan to redesign the healthcare system within 3 months. So they achieved what they were hired in to do. But what was also interesting was that the clinicians and managers working in the healthcare system, who'd been around for 10 or 20 years in the healthcare system, didn't think that was enough time to actually redesign the healthcare system or buy into it. And they were also likely to be around for decades after the management consultancy project end. And so, although they weren't able to sort of overtly challenge the management consultants because of the kind of huge time pressure and the consultants' ability to persuade them to do certain things, they basically waited around for the consultancy project to end. And then literally the kind of week following the consultancy project finishing, they basically started throwing in really difficult, challenging questions and started unpicking the redesign, and due to wider changes in the healthcare systems, but also the problems that local clinicians and managers raised, basically the project fell to pieces. So what was interesting here, as I say, the way that people draw up on time. Consultants draw up on a very short time frame. They said this is an absolute mission critical thing we need to do within 3 months, but was it, is the question. Whereas the clinicians and managers had a much longer time frame, and they kind of basically waited out for the consultants to leave, and then they were able to kind of ask questions and challenge the design plans that the consultants had put into place. So basically what this highlighted to me was the ways in which people can use time and timeframes and temporal orientations to construct problems and their solutions in particular kind of ways. And often how these things might be slightly political. They might not objectively be what is the best and right thing to do. They might reflect the interest of individual actors in collaborations rather than the best interest of the collaboration overall. And so in this paper, I'm particularly looking at this notion of temporal ambiguity. So people can probably see the image here is again, it's a kind of famously ambiguous image. So is this an image here of an older woman or a younger woman? And of course, in the image, you can see both an older and younger woman. And this is, again, classic example from psychology of a very ambiguous image that people see in different kinds of ways. And in this paper, I'm going to basically talk about this issue of ambiguity and uncertainty. So I think one of the things I find really interesting about this research is the fact that the future is uncertain. We just don't know what's going to happen in the future. It's inherently uncertain. Things happen in ways that are predictable, but sometimes unpredictable. So the future is inherently uncertain. We don't know whether by doing something it's going to produce the results that we expect. And this is because we lack information about future events. Certain things might arise that we hadn't thought of, that are unexpected, which lead the future to be different to what we expected. But also futures are also ambiguous. And this basically involves people defining futures, for example, the new kind of 10-year plan in slightly ambiguous, imprecise ways. So what exactly does it mean to develop sort of network-based, neighborhood-based care? What does it mean to kind of shift from kind of towards digital, towards communities and prevention? It's a good idea. I think we can probably all buy into it in theory at the high level, but what precisely do we mean that? And might people be thinking about these kind of three big shifts that are going to affect the NHS in different kinds of ways, indeed in conflicting ways that clash with one another? So ambiguity is about having ambiguous and potentially different definitions and interpretations of the same phenomena. This is kind of quite useful. So obviously ambiguity can be problematic if you're not talking about the same thing. But when you're trying to get people to collaborate with one another, there's this concept of strategic ambiguity, which could be quite useful. So we can broadly buy into a kind of collaboration, perhaps to implement the new NHS plan, the three shifts that have just been announced this morning. But this is useful because we can kind of draw upon slightly different understandings of what these sort of ambiguous concepts mean, and these can provide the sort of starting basis for us to collaborate. But of course, things can potentially unfold later on if it turns out we're actually talking about the same term in slightly different ways. Another kind of issue around sort of ambiguity is this notion of hype. So I don't know if there's any hype in the sort of the announcement of the NHS plan this morning, potentially, but another thing that's kind of quite useful to get people to collaborate is to kind of create hyped future expectations. And the importance of these future expectations is if people get very excited about things that are about to happen and believe they're going to happen, then they put resources into making these things happen. So, for example, you might think about AI as being something that's very hyped at the moment. Again, I'm sure AI is going to have a big and hopefully to some extent positive impact on the healthcare system, but there's lots of hype around it, kind of solving many of the challenges we're facing in the healthcare system. We're putting lots of money into doing that. Will AI and will the kind of hyped expectations of AI deliver in the future? We will see in the future. And finally, I want to talk about this notion of temporal ambiguity. So my colleague, Sam van Elk in the business school, recently published a really nice paper about temporal ambiguity and what he describes as promissory futures. And he did a study looking at how to change health and care systems in the context of austerity. And he basically talks about how actually kind of promising great things in the future in a slightly ambiguous way is a way to resolve intractable conflict in the present. So if you can't agree things to resolve problems in the short term, a great thing to do is say, well, in the future, everything is brilliant and wonderful, and we'll resolve it then. And people often can agree to resolve problems and to address conflicts in the future. So again, this might be thought of as a form of kind of strategic ambiguity that gets people to collaborate and overcomes potential conflict. So the paper's research question is, how does temporal ambiguity, so this is sort of ambiguity, this is imprecision, this is different conceptualizations of time and temporality, affect inter-organisational collaborations where these collaborations contain different organisations, professional groups, individuals with different temporal orientations. So they draw upon time and temporality in different kinds of ways. So the empirical case we explore this in relation to is the case of what was known as genetics knowledge parks, which, as I said earlier, were funded by the UK government for 5 years to bring together different stakeholders, so people from government, from the Department of Health particularly, academic clinicians and social scientists, and people working in the NHS, so clinicians and managers. And funding was to bring them together to mobilise or translate, depending on your language, genetic science into practice. So again, at the time, there was huge amounts of excitement about genetics changing healthcare. We studied 3 of what were 6 genetics knowledge parks that were funded. So one we title, it's a pseudonym, Cardiac GKP, and this park was set up to mobilise cardiac genetic science into healthcare. A second park, which was we called Public Health, GKP, which was designed to develop the discipline of public health genomics, and a third test, Gen Test, GKP, difficult to say, and this was set up to speed up and develop new genetics tests for rare conditions. We did a series of interviews over many years. So we interviewed a bunch of people, 34 people, policymakers and people involved in establishing GKPs as they were being set up. We then interviewed people again, a similar set of people as they came to close. And then finally, we followed up almost 10 years later with people who had been involved in the Genetics Knowledge Parks to see what longer term impact they had had. And just to sort of kind of spoil the story, so the GKPs actually closed without mobilising genetics into practice. But again, there were questions about whether this actually had longer term benefits, which I'll come back to. So we kind of engaged in a process of kind of theorisation. Initially, it wasn't a study of temporality, but temporality in time really came out. And so we used this sort of theoretical idea to explain what happened in practice. So going to describe a number of phases around the creation and the process of the life cycle of the Genetics Knowledge Park. So they were broadly formed around kind of government hype. There was a government document that talked about the potential of genetics transforming healthcare. And then there's a really kind of nice passage in the government document where they talk about British geneticists' outstanding record and likely big future impact in the area of genetic science. So we've done it before, as I said, drawing on past to show that in the future, British geneticists will transform how we think about healthcare. The document also announced 5 years of funding for genetics knowledge parks. But what was really interesting here was there was real ambiguity about whether this was just 5 years or whether this was the first round of funding for 5 years. So what would genetics knowledge parks have to do to get a second round of funding to continue the work they're involving? And people talked in different ways about whether this was just a one-off piece of funding or whether this was the first in a series of funding. Somebody said that whether these things would be refunded was shrouded in vagueness, as well as what they were supposed to do to get refunded. So again, lots of temporal ambiguity about the funding horizon for genetics knowledge parks. But this was kind of useful for some people who are working in the knowledge parks, the scientists who wrote what was described as cleverly woolly proposals, which basically provided them for funding for ongoing scientific research while they were promising translation in an open point in future. So basically, genetics knowledge parks were ostensibly there to translate genetic science into practice, but they also enabled genetic scientists and other scientists to continue doing their kind of day-to-day scientific work. So they were very useful as a resource. But these scientists talked about promising translation in the future. So the genetics knowledge parks sort of continued doing their stuff for about two and a bit years, at which point the Department of Health decided to kind of review the progress that they'd made towards this translational goal. And as somebody said, we realized things were going very, very wrong. So at this point, they decided that the ambiguity about what people were supposed to do within particular timeframes, so again, focusing on the temporality, was the problem. So they imposed a quarterly reporting on genetics knowledge parks. So every 3 months, the people running the genetics knowledge park had to report on the progress that they'd made towards their translational goals. So this can be seen as imposing a closed quantitative temporal orientation on the knowledge parks. So this was designed to kind of hasten process, to give people a sense that they needed to do lots in a short space of time. But the unintended effect of this was that people within the genetics knowledge parks thought that this was seen as the changing of the rules, and which undermined the basis on which they argued they'd agreed to collaborate. And also it kind of undermined their belief that they could actually deliver the goals of the genetics knowledge park within the remaining 2.5 or 3 years. So as various people said, it's hard to fit progress into a quarterly report because the nature of genetic science doesn't work like, as someone says, that the time frame for discovering new genes is much slower than that. So they talked about just sort of ticking the same boxes because nothing had really changed because genetics moves much more slowly. And other people said, it's been ludicrous. I would never have applied for this money again if I'd known I'd had to be reporting like this. So they say it really undermined the sort of the moral basis, the sort of ethical basis of which these scientists argued they'd agreed to get involved in the initiative. As a result, some of the senior scientists who had first been involved in the network basically had had enough. They weren't interested in being managed in this way, so they decoupled from the network and went off to pursue other exciting genetic opportunities elsewhere. Some people within the networks started kind of realizing that it was unlikely they were going to get more funding from the Department of Health, so they just started what we describe as prospecting for new resources. So in cardiac genetics knowledge part, they did a health economic analysis trying to show that funding a cardiac genetics service would save money to the country and to the healthcare system. But they were unsuccessful because the commissioners were concerned that by setting up this new service, they were creating new future costs. So they didn't get funding for this. Public Health Genetics Knowledge Network set about trying to get new charitable funding. GenTest GKP realised it was unlikely to be refunded, and they started talking to the local NHS hospital about being absorbed within them. But again, ironically and kind of perversely, kind of imposing quarterly reporting on the Genetics Knowledge Park seemed to sort of exacerbate temporal ambiguity. So people really didn't know what was going on and how long they were going to be working on the Genetics Knowledge Parks now, because it was really unclear as to whether they were refunded. And as a junior researcher, a health economist described, it's really confusing because you're trying to work on finishing your Genetics Knowledge Park project, but at the same time you're trying to write new bids to get new funding, potentially outside of the Genetics Knowledge Park. So it was really confusing, really unsettling. And they also said, because it's possible or indeed likely that I'm not going to have a job in the Genetics Knowledge Park in a year or two's time, I'm going to be looking for jobs elsewhere. So as I said, it sort of unsettled and really exacerbated this sense of how long do we really have to work on this project? Is it really worth doing that? Should I be looking elsewhere? So it really, so time and the remaining time that people had in the network really became a huge issue. And then finally, as I said earlier, the Genetics Knowledge Parks closed without actually translating any genetic science into practice. So that was within 5 years. But various people said, we did quite close to that. We almost got a service commissioned. Other people said, we're doing things that are probably going to produce some valuable results, but not quite yet. We haven't quite been able to achieve that within the 5 years because of particular delays. And as this person from GenTest GKP says, to the people who are making judgments about the progress, it just looks as if we'd be doing nothing. But they argued they were actually making much more progress towards a longer term aim. And similarly, the people sort of blamed this sort of ambiguity around the sort of funding timeline for their not producing what they're ostensibly supposed to do within 5 years. So people talked about the nebulous wording, and you couldn't really pin down whether this was really going to be a 5-year project or a 10-year project. And as this person said, if we'd known it was just going to be 5 years, we wouldn't have done lots of expensive things that were aiming towards longer term goals. So the people within the network blamed temporal ambiguity for not achieving what they're supposed to achieve. So this is where it gets perhaps a bit complicated, so I'll try and explain this. So, what's going on here? How do we explain what was going on? So here we draw upon the work of Latour and Fulgar, who did a kind of seminal study of scientific work. And one of the really interesting models they have in their book is the idea of a cycle of credibility. And this will hopefully ring true to anyone who's working in higher education. And they talk about how as a junior scientist or indeed a junior academic, what you need to do to further your career is to win resources. So maybe that's a kind of PhD place on a postdoc, a bit of money to do some research. And what you need to do, having won the resources, is produce outcomes or outputs that are valued in your academic community that give you credibility. So if you produce something, if you produce a paper, if you produce a report, then your peers in your own scientific community will consider that you have the credibility to win new resources, which enable you to produce more outputs and develop more credibility in your longer term careers. So we kind of use this model of cycles of credibility to kind of explain what was going on in the case. So the scientists in our GKPs had to produce particular outcomes for these research publications that gave them credibility within the wider scientific communities. But what was interesting, that their time frame for doing this, so their temporal cycle of credibility, were quite long term and open. So you produce that kind of world-changing paper. When you produce that world-changing paper, this kind of clashed with the mindset of people in the Department of Health, who were very much thinking of this project potentially in a shorter, closed 5-year time period. So what we've done in the paper, we've tried to sort of complexify, and this is probably far too complicated to talk about here, but talked about how traditionally scientists have had funding from within their own communities. Increasingly these days, people get funding from inter-organisational collaborations, where you're collaborating with people across different disciplines, across different kinds of organisations. So in this case, we have scientists collaborating with the Department of Health, who are collaborating with people in the healthcare system. And the point, I guess, here is that in theory, what the GKPs were designed to do was to sort of help all of the different actors who are involved to kind of mobilize resources and produce outputs and forms of credibility that were valued in their own different communities. But the problem here, of course, is that the Department of Health, particularly at the end, really saw this as a 5-year project, whereas the people who are working in science thought about their work in much longer terms in a kind of open time frame. So initially, as you can see, I don't know if you can see the slide here, initially we have some resources that flow into the genetics knowledge park, which then flow into the scientific community. So these things in theory should drive all the kind of credibility cycles, both for the genetics knowledge parks, but also for the scientists who are involved. And this is kind of produced with the expectation that they will produce outputs that in turn deliver credibility to scientists, to people involved in GKPs, and to people in the Department of Health. But again, here we see, I don't know if you can see in the middle, you see this sort of ambiguity around the kind of time frame. So how do you bring together a bunch of scientists who work in an open time frame with people in the Department of Health who work in a very fixed, shorter term time frame? And we talk about in the paper how you do that by creating a sort of temporal ambiguity around the time frame for the funding. So it was useful to bring together these different stakeholders by being ambiguous about how long the funding was likely to go on for. And unfortunately, what happened was that when the Department of Health finally decided that they were only going to fund the project for 5 years, this sort of stalled the cycle of credibility within Genetics Knowledge Park and led to the scientists realizing that they weren't going to be able to further their longer term ambitions and produce outcomes of credibility that they valued. So they started decoupling from the Genetics Knowledge Park initiative, and they started what we describe as prospecting for new collaborations and new resources that were likely to be more useful to their longer term careers. On the other hand, the Department of Health on the left-hand side, they started also prospecting for new collaborations that were also more likely to deliver outputs that were valued in their sort of kind of policy community. So we kind of developed this figure to hopefully kind of make sense of what happened in the knowledge parks overall. So the point here is that traditionally Latour and Vulgorod talked about kind of uni-professional scientific communities and cycles of credibility. Here we talk about cycles of credibility in the context of collaborations, involving people with different timeframes, different temporal perspectives on collaborative work. But what was also kind of interesting, although the Genetics Knowledge Park closed after 5 years without achieving their ostensive aim, actually, when you talk to people about their involvement in the GKPs, they were surprisingly positive about their involvement. So a social scientist who was involved in cardiac GKP at the close basically said, actually, this has been a brilliant success for me. And as a result of working on the GKP, I've got new relationships with scientists. And as a result of that, I've got new grants, which enabled me to build up a new big network. So for certain scientists in GKPs, it was really successful. It helped further their longer term academic careers. People also talked about how, although GKPs themselves had not achieved their ostensive aims within 5 years, they'd actually provide the sort of foundation for the development of translational science and genomic sequencing in the wider NHS. So the director of cardiac GP claimed that GKPs had been very valuable in that respect. And other people talked about how GKPs had morphed into what we now have, which are biomedical research centres. So somebody from Gentest GKP talked about how basically the new biomedical research centre in the site where they were based is now one of the biggest and most comprehensive genetic centres in the UK. And this they saw as the offspring of Gentest GKP. So in contrast to the 5-year outcome, they said actually it did lots of really useful work that's been very beneficial in the longer term to genetics and translational science in the UK. And indeed, it could be that some of the work done in GKPs actually helped us address develop vaccines that address the COVID-19 pandemic. So again, it gets even more temporally complex and ambiguous when you think about the impact of these initiatives and collaborations in the longer term. So contributions, what's kind of useful here? So I think the first thing I want to point out is that we need to think about sort of the time frames and the temporal orientations of people involved in collaborations and how these might be interconnected to particular aims within collaborations. So although people might talk about signing up to a kind of common collaborative aim, they have their own agendas that are going on behind the scenes, and they might be thinking about these wider agendas through different time frames, different temporal orientations. So the first point is that if we're developing collaboration, we need to think about timeframes, temporal orientation, to anticipate things that might happen as collaborations unfold over time. Second point is around the notion of temporal ambiguity. So as I said earlier, it's really useful that there was a ambiguity around how long the GKPs were going to be funded. Perhaps if people weren't, if there wasn't the ambiguity around the funding timeframe, people wouldn't have got involved. But it's also problematic. Although having an ambiguous kind of funding horizon was useful in terms of getting buy-in, it also seemed to undermine the collaborations in the longer term. So I think we need to think about the sort of Janus-faced nature of temporal ambiguity. It can be helpful, like strategic ambiguity, but it can also undermine collaboration in the longer term. So when we go into collaborations, if it's a bit ambiguous about what we're doing and how long we're doing it for, do we need to kind of talk these things through before we formally commit to getting involved in collaborations? The other thing we've done in the paper is developed this model of sort of interrelated cycles of credibility. So again, if we're thinking about collaborations, what are the forms of output and credibility that different collaborators are looking to achieve, and when do they need to achieve that in order to succeed in their individual professional group or organization? And again, if perhaps we thought about these different cycles, this might help us develop more sustainable collaborations. And of course, these things are driven by kind of resource and credibility of flows across different cycles within collaborations. So we see in the genetics knowledge case, these GKPs morphing into these biomedical research centres. So again, do people think about these collaborations in short term? Do we need to think about them beyond the actual organisational form themselves, kind of with resources and credibility flowing between actors involved over time? And then finally, in terms of policy implications, as I said previously, before we get into collaborations, perhaps we need to think about the interrelated nature of individual aims and temporal orientations. Are people, collaborations are inherently uncertain and ambiguous. We just need to accept that. But might people use this ambiguity and uncertainty in political ways that are serving their own agendas rather than necessarily the interest of the collaboration as a whole? And if we were to kind of think these temporal issues through in advance, are we more likely to develop more sustainable and more successful collaborations? So that's really my presentation. I apologise for it being very, very complicated, as it probably is, but I thought it'd be useful to talk about the ways in which timeframes and temporal orientations affect collaborations, and say maybe by looking into these things, we can develop more sustainable, more effective collaborations. And I'll stop sharing my slides now. So yeah, we'll welcome any questions and keen to get your feedback and hear if it's too complicated or nonsense, or whether it kind of resonated and chimed with your own experiences.
Thank you very much indeed, Jerry. And I just think it's fascinating how we often overlook the time element and how people view and manage time. And I think you have, through those examples, given us a real feel for that. And it's curious for me to think about it as well, because of my interest in palliative care, and time in palliative care can be quite viewed differently, which is why we struggle with QALYs, quality adjusted life years. So I'm very keen to open it up for questions, if people have one. Yes, I can see one hand. Richard Harding.
Good afternoon. Can you hear me okay?
Yep. Hi, Richard.
Yes. Well.
Hi. Thank you so much. That was a very, very interesting presentation. And thank you for the nice examples, which made some of the conceptual stuff much clearer for many of us, I'm sure. So I think you touched on the big thing that people in health research will recognise, which is our desire as academics to do relevant research that's really cutting edge and timely, and that it's going to get the impact that we want. But of course, what we know is that good quality research takes time, and then it takes time to get out, and then it takes time for it to be picked up, and then it's not always timely then for the people that need it. And politics is a fast moving world, isn't it? You know, we've seen that in the last 10 years. You might be health minister the next day, and you're certainly not the next one day, you're not the next. So where can we do this better? Where does the responsibility lie? How can we try and align some of our temporality that understands the policy immediacy and the research need for quality and time? Is there anything you've seen that's kind of improving this, or any dialogue that helps this? Because I think many of us will recognise it. Thank you.
Yeah, fantastic question. I think it's one I've kind of grappled with myself. I think, again, particularly, I mean, I remember when I first started collaborating with sort of kind of clinical researchers who've done more quantitative research, which I understand to be certainly kind of quicker to produce than the research I do. I remember speaking to my colleague and saying, you know, where's the paper? And I think it had been about 6 months at that point, and my papers usually take a year or longer to produce. So I think the first point is to acknowledge and accept that actually different kind of disciplines within academia kind of work at different speeds. And I think we need to sort of perhaps think about a sort of kind of hybrid strategy of kind of producing different kinds of publications for different audiences. So in my field, a couple of weeks ago, I had a paper that was rejected after, I think, 4 years, and it had been sort of best part of a year in a journal under review, took enormous amounts of research, and it got rejected. But that was one of the most kind of prestigious journals in our field. So in my field, we're sort of incentivized, and you get this you know, you get the credibility for producing these massively, perhaps arguably over-theorized publications. That's where the credibility lies. So do we need to have sort of, or do we need to kind of change the kind of nature of what you get credibility for in different academic fields? And so I think first we need to sort of understand the nature of each other's different you know, publications and what you get credibility for. And then perhaps I think we need to produce perhaps 2 different kinds of publications. So one might be your sort of quicker policy publications that you can get out to policy audience, and then you might produce at the same time another publication that will be more kind of targeted towards your own academic community. But I do think these different norms and these different sort of time norms are really important. We don't speak about them, we don't understand them, and I think by not doing that, people, you know, perhaps if you collaborated with someone in my field, you might be very frustrated by how slow we are, or perhaps people in policy world might be very frustrated by how slow academics are more generally. But perhaps it's just a lack of understanding. So maybe we need to educate people more, but also produce sort of these twin publication strands of sort of quick and dirty, but you know, get the results out quickly, but then produce kind of better quality stuff at the same time. But it's a tricky one. It's a real tricky one. And I think we as academics, we have a responsibility also to, you know, to contribute towards policy a bit more, I think.
Thank you, Jerry. Richard, did you want to come back on that at all with any reflection?
No, I think you've there is no simple answer, is there? I think in enhancing each other's understanding, I think it's important. And something you raised in your presentation was about clarity is really important as well. I think that's one of the earlier points that you made, is clarity and reducing any misunderstanding on the timeliness of when things are going to be delivered is really, really important, isn't it? And I think there's something else about speaking each other's language, isn't there? What as academics, what can we do that may be a little bit more timely, that's in the language and the format that people need? Because it's not just, you know, there's temporality and there's language, isn't there? We may inhabit different time zones and speak different languages just to add to the dimensions of this. So I think that's another angle, maybe.
Agree.
Thank you very much. Thank you, Richard. Thank you, Jerry. So I've got a couple of questions coming forward. One from Kimberly. So Kimberly, if you want to ask your question now, and I've also can see a question in the Q&A from Chloe Waterman. And Chloe, if you want to come on screen and ask that question, do. Otherwise, I'll read it out for you. Kimberly.
Yeah, my question was also about solutions, so how to overcome these issues that you talk about. So in terms of us gaining better understanding, so we can try to educate each other, but do you think there's more of a role for introducing interdisciplinarity in education? So for example, at undergraduate level, postgraduate level, and our doctoral schemes, some like the UKRI PhD schemes are building in now that you have to do placements in policy, for example, or in health economics if you're a clinician, but it's not completely widespread. So I was thinking if you're embedded within a different culture, you kind of live it in it rather than being told it, and maybe it hits home better.
I think it's again, I've kind of reflected on particularly my own discipline, but disciplines more generally. I think there's definitely a place for more embedded research, more interdisciplinary research, and the funding bodies are all pushing us towards that. But at the same time, we've got this very sort of traditional and very specialized perspective within particular disciplines, whereby you get, it's coming back to this kind of cycle of credibility. The biggest prestige and credibility is often to be a kind of hyper specialist who can basically talk with, 4 or 5 other colleagues in the world and nobody else. And that's kind of where you get the credibility for. So maybe we need to kind of shift the prestige and credibility in our disciplines to value more, interdisciplinary work more. And until we do that, people are almost by default going to kind of fall back. Because I work in an interdisciplinary way, but often the work that we produce isn't massively valued in my discipline and might not be massively valued in someone else's core discipline. Not to say it's not incredibly important. So maybe we need to sort of think about shifting what is the credible, legitimate thing to do, and we need to do that. Otherwise, people will by default kind of fall into the specializations, which is tricky. So I think it's more than just spending time. I think it's trying to create new disciplines or more interdisciplinary disciplines that are valued and credible within the wider academic community, and then perhaps by doing that we're going to be more able to do interesting things. And it strikes me, so many of the problems we're facing. I was talking to the NHS plan come out today. The nature of the solutions to the problems we're facing are interdisciplinary. Perhaps the kind of hyper specialization isn't addressing many of the key problems we're facing to stop the healthcare system collapsing. So I would call for a more interdisciplinary, or more valuing of interdisciplinarity within our wider professions. And that obviously starts with spending time with other people. But I think we need to sort of change what is valued within the wider academic community. I don't know if that answers your question, Kimberly.
Kimberly, did you want to come back? Okay, thank you. Chloe, you've put a really interesting point in the Q&A. Do you want to speak to that?
Yeah, I can do. Yeah, I was just it's as you were speaking, it was reminding me of some work that I did a while ago in my PhD, where I was looking at how people with dementia are kind of required to make certain decisions at certain times, and the legal definition of that time frame is obviously very different to how a person with dementia might experience time. And that emphasis on time being so key, but neither kind of environment speaking the same language. And yeah, it was just kind of making me reflect quite a lot on that. And again, I guess it touches on that thing around interdisciplinarity and recognizing that different types of knowledge are going to be valuable to like the human experience. But yeah, I was just wondering if you had any practical insights, but I think it's just thinking as kind of a, when planning kind of projects and things like that, is there a way that, I don't know, with managing expectations or something, or just kind of trying to factor in the fact that, policy can move really quickly or really slowly as well in terms of law, that can take years and years to do anything. So how do we manage those?
Again, it's something I kind of struggle with a lot myself over the years. I think, as I say, I think the first kind of starting point is really just having conversations. So kind of talking to people across disciplines about, what are the really valued publications, or what are the really valued outcomes in your discipline, and how long do they take to produce, what kind of things do you, and then at least we kind of, it's not that somebody's being lazy or distracted or it's just that the nature of the publication takes a long time to produce. Or for someone else, it might be that you're used to producing, like me, paper that takes a year or two to produce, and for someone else you're just sort of deeply frustrated because nothing's happened and you've kind of moved on to 4 or 5 different things in the same time. So I think the first point is having these conversations about what kind of papers do you produce, how long does it take, what kind of outputs do you value, So that's the first point. And then, as I say, the wider point, which is obviously going to be more time consuming, is kind of shifting the disciplines, and so that we actually value these interdisciplinary spaces a bit more, and that you say don't need to be the hyper specialist. So I think thinking them through, just sort of pointing out the elephant in the room. I think time is an elephant in the room that we don't think about, and as I say, it can be used very politically. So again, if you want to see my other paper about management consultants, if you want to read about the masters of using time to serve their own agenda, then read up about management consultants, because they're brilliant at it. They'll get you to see the world in 3 months as if nothing else existed, and then the day after they leave, everything changes.
I think we love that one. Ian Kessler, yes.
Hi, Jerry. Thanks for that paper. Really interesting.
Thanks, Ian.
I suppose my question is about the regulation of time, which clearly does take place in different research contexts. So we all know that when we apply for NIHR funding, we have to produce Gantt charts.
Yeah.
Jess, who's on the call, I think now, we work for the Policy Research Unit, and we have to do short-term pieces of work for the department, which have got a very specific deadline, which we can't miss. And I mean, many years ago, I was a research officer in a trade union. I did research for negotiating officers, and I was given a brief that had to be completed the next day. So time can be regulated in that context. So I suppose the interesting question is, in your case, why wasn't time regulated when it was quite obviously an issue? Was it around the kind of strategic ambiguity that you hinted at? Was there a vested interest in not trying to regulate time? Was it are there certain contingent conditions which make it difficult to regulate time? These are clinical scientists. Maybe social scientists don't operate on the same, which is where your interdisciplinary issue kicks in, I suppose. But I suppose what makes your case special in terms of temporal ambiguity arising in that particular context? And are there other research spaces where temporal ambiguity won't arise, or are we saying that temporal ambiguity is inevitable in any kind of research context? If that makes sense.
No, it's a brilliant question. So I mean, clearly there are certain things that, there's no temporal ambiguity around. So if I'm teaching a lecture at say 10 o'clock on a Tuesday morning, and I need to prepare my lecture slides by 10 o'clock on a Tuesday morning. So there are many instances in which the deadline is fixed. There is no ambiguity around the temporality. But this is a kind of different kind of thing, and this is whereby I think, so what was interesting here was that genetics was this new thing that the Department of Health, I think there's a quote basically saying the minister said that genetics was sexy, and all of a sudden, the Department of Health wanted to put loads of money into genetics, but nobody really understood what genetics was at that time. So there were people talking about, have you heard of this new genetics thing, DNA? It's going to change healthcare. We need to be ahead of the rest of the world, and because obviously we've got loads of great geneticists in the UK, we need to be ahead of the world, kind of leading the way in terms of genetic science. But very few people actually really understood what genetics was deeply. And so what was kind of interesting here was there was this interrelationship between doing this kind of complex thing, which was not really very well understood for very many people outside of the scientific community, and the sort of time frame for it producing the results. So I think there's many things that we do. I mean, many big innovative kind of healthcare things that go on, which are kind of interesting, but we don't really understand them. And coming back to what I've ranted on about us being kind of hyper specialists in our tiny niches, we just don't really understand these things. So it really that gives an opportunity for people who are expert to kind of shape the timeframes for doing these things. And then in this case, the Department of Health gradually realised that some of the things that they'd hoped for just weren't being delivered. And so I think the interesting sort of rub here is that the world is inherently uncertain and ambiguous just by the nature of it. But at the same time, sometimes people use that uncertainty and ambiguity to pursue their own ends. And what is objectively true and what is politically true is difficult to determine. And we just can't see between that. So again, I think what I really want to do is just get people to start thinking about these things. And I don't have the answer, but by thinking about these things, we can perhaps understand it better and, as I say, produce more sustainable collaborations. But it's, as I say, it's not like you doing your policy brief for a trade union the next day. You know, that has to be done. But, you know, coming up with a new innovation, you know, tackling a new disease that nobody really understands, these are the kind of things that are more temporally ambiguous, I think.
Jerry, thank you very much. And we're getting to the end of our time, but one of the things, so as Ian said, we're managing time, so we'll be careful about that. But one of the other things that strikes me is that how much of what you say is very relevant to university NHS collaborations as well.
Absolutely.
And there was a meeting just a couple last week, which was hosted by Graham Lord, and to give them an advert, a joint book pamphlet that's come out between the Policy Institute and King's Health Partners on university and NHS relationships. And the room was full of people from both university and NHS sides, and some of the issues that you have raised were there in the room, with people from the NHS saying, yes, but I have to get my waiting list down tomorrow. And other people saying, yeah, but it's going to take time to figure that out. So I think you've given us some brilliant information, and it is so relevant to Better Health and Care Hub, because we're trying to collaborate in the environment that you've just described, and also have an impact in the environment that you've just described. So thank you very much for a wonderful talk and really useful information. And thank you everybody else for joining us. Just going to highlight two things, or just a few things. We'd love to get your thoughts. So my colleague Abby has very kindly put into the chat your thoughts on Mentimeter. We're very interested to know more from you about topics you'd like to have covered, and also get some feedback. So please click on that and give us some feedback. We will be back in early September with a new webinar series. So we'd love to see you at that, after that event. And the other thing is that earlier this week, on Tuesday, we launched information about our accelerator grant scheme. And I'll put a link in the chat to the page to that. The recording from Tuesday's webinar will be uploaded in a little while when it's ready. But here's the link to the accelerator scheme. So do take a look at that as well. And if you'd like more information about this or anything else, then you can email the Better Health and Care Hub email account. So Jerry, thank you. And thank you everybody for coming. Been really great to see you. And thank you also to Abby, especially, for getting it all set up for us.